Hi everyone. Welcome to RSB Healthcare Consulting. Remote Patient Monitoring, a comprehensive study. Healthcare is a field that is rapidly developing in technology and services. A recent development in this area is remote monitoring of patients, which has many advantages in a fast-aging world population with increasing health complications. With relatively simple applications to monitor patients inside hospital rooms, the technology has developed to the extent that the patient can be allowed normal daily activities at home while still being monitored with the use of modern communication and sensor technologies. Sensors for monitoring essential vital signs such as electrocardiogram reading, heart rate, respiration rate, blood pressure, temperature, blood glucose levels and neural system activity are available today. Range of remote healthcare varies from monitoring chronically ill patients, elders, premature children to victims of accidents. These new technologies can monitor patients based on the illness or based on the situation. The technology varies from sensors attached to body to ambient sensors attached to the environment, and new breakthroughs show contactless monitoring, which requires only the patient to be present within a few meters from the sensor. Fall detection systems and applications to monitor chronically ill patients have already become familiar to many. This study provides a review of the recent advances in remote healthcare and monitoring in both with contact and contactless methods. With the review, the authors discuss some issues available in most systems. The paper also includes some directions for future research. Introduction: Remote healthcare is an emerging research field as the world moves towards remote monitoring, real-time and fast detection of illnesses. Remote healthcare has many categories, for example telehealth, mobile health, all of which mean monitoring of patients outside hospital conditions by the means of technology. The advantages of remote monitoring of patients are: early and real-time detection of illnesses, ability to continuously monitor patients, prevention of worsening of illnesses and untimely deaths, cost reduction in hospitalizations, reduce the number of hospitalizations, obtain more accurate readings while permitting usual daily activities for patients, improve efficiency in healthcare services by utilizing communication technology, emergency medical care, service for patients with mobility issues, emergency care for traffic accidents and other injuries, and usage of non-invasive medical interventions. Remote monitoring of patients targets several subgroups of patients, such as patients diagnosed with chronic illnesses, patients with mobility issues, or other disability, post-surgery patients, neonates and elderly patients. All these types of patients have conditions that are better to be monitored continuously. The aim of good healthcare is the ability to support ordinary life as much comfortable as possible to all patients. Most research follow the policy of allowing the mobility and activity freedom at home or personal environments which are beneficial for the patients rather than being confined into a high-cost hospital room. Therefore, whole systems are being built to support this concept with the use of different technologies. With the new remote health monitoring applications, elderly patients can engage in daily activities without support from a caretaker. So, these applications support activities like sitting, standing, using a bathroom, watching television, reading and sleeping, with least inconvenience to the user. Even if there are wearable sensors, these pose minimum effect to the activities. One such example is smart wristwatch-based sensors. For the patients of accidents and sudden injuries, the time they are monitored remotely could be only the time they are being transferred to the hospital in an ambulance. Nevertheless, efforts have been focused on safe journey to the hospital, and remote monitoring helps for immediate medical interventions for highly critical cases. The doctors can monitor the deterioration or maintenance of the patient while also advising the paramedics who are physically with the patients as necessary. When it comes to designing a remote patient monitoring system, several challenges exist. Choice of whether to use with contact or contactless method, choice of sensors, processing algorithm and communication network are the main decisions to be made when designing a remote monitoring system. Obtaining accuracy and reliability is another challenge. Receiving the approval of medical community and the consent of the patients is imperative. This study is motivated by above challenges and the importance of these systems to the general public. Remote patient monitoring systems are designed to obtain a number of physiological data from patients. Most common data are electrocardiogram, ECG, electroencephalogram, EEG, heartbeats and respiration rate, oxygen volume in blood or pulse oximetry, signals from the nervous system, blood pressure, body/skin temperature and blood glucose level. In addition to these, sometimes, weight of the patient, level of activity of the patient and sleep data are collected. A number of researches have been done for wound management and sleep monitoring applications. Traditional systems collect data using sensors attached to the body. But these systems pose difficulty in terms of mobility for the patient and a patient's activities and daily living. Since this kind of devices influence patients' comfort, sensitive physiological data get influenced. So the readings may not represent a patient's actual illness but rather the discomfort a patient, especially an elderly patient, is undergoing at the time a physiological reading is being taken. While there are many situations that invasive or with contact interventions are necessary, novel research look into methods for obtaining physiological data as non-invasively as possible. For this end, contactless methods are being researched on extensively during the past few years. In this paper we discuss both with contact, i.e. contact-based, and contactless methods as both these types of systems are important for a researcher in the field. General surveys on contact-based RPM systems. Remote patient monitoring concept first came up with contact-based methods. These systems use different sensors, processing technologies, communication technologies, post-processing actions, databases and receivers/end terminals. They also target different diseases. The variety in systems may exist due to the designer's choice or the desired outcome of other special features, embedded, low cost, low power etc. The system designer planned for its users. For example, the designer may have been targeting a system with increased power efficiency or medication management. General surveys on contactless RPM systems. Contactless remote health monitoring methods can be categorized mainly into two sections, image-based methods and radar-based methods. Image-based systems analyze images of patients as their data and detect illnesses or falls. Radar-based methods used radio frequencies to get inputs for their systems and also sometimes have patient localization capability. These systems are comparatively new, only few years since inception, so there are a lot of areas for improvement. Although it is the case, some works of research have achieved good outcomes. The remainder of this section discusses some of the very recent reviews on contactless image-based patient monitoring methods. We chose only 4 categories based on the criticality and prevalence of them in the present society. 1. Cardiovascular system and respiratory system related diseases. 2. Fall detection and mobility related diseases. 3. Brain, neurological disorders and mental health. 4. Diabetes. The above four sections were decided to be included in the view that most of the patient's monitoring technologies target the ailments that fall under the above four. In each category, two further classifications present: contact-based and contactless efforts. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.